प्राकृतिक रूप से गर्भ धारण करने में असमर्थ जोड़ों के लिए आईवीएफ आशा का नया किरण है। इसे देखकर अपोलो हेल्थ एंड लाइफस्टाइल और अपोलो हॉस्पिटल समूह द्वारा अपोलो फर्टिलिटी ने दिल्ली के लाजपत नगर में अपना सबसे बड़ा आईवीएफ केंद्र शुरू किया है। इस केंद्र के उद्घाटन अवसर पर कृति गर्ग आईएएस उपायुक्त पश्चिमी दिल्ली, डॉक्टर अश्वनी कुमार आईएएस, स्विंग फाउंडेशन संस्थापक मदन मोहित भारद्वाज, अपोलो फर्टिलिटी सीओओ अनुभव प्रशांत, वरिष्ठ सलाहकार प्रजनन चिकित्सा और आईवीएफ डॉक्टर श्वेता गुप्ता आदि उपस्थित रहे। इस मौके पर मीडिया को ब्रीफ करते हुए आईवीएफ विशेषज्ञ डॉक्टर श्वेता गुप्ता ने कहा, पिछले कुछ वर्षों में इनफर्टिलिटी की समस्या युवा जोड़ों में बढ़ती जा रही है। गतिहीन जीवन शैली, तनाव, अनियमित नींद पैटर्न, मधुमेह, मोटापा, धूम्रपान और शराब भारत में इनफर्टिलिटी को बढ़ाने में मुख्य कारण है। वहीं अपोलो फर्टिलिटी सीओओ अनुभव प्रशांत ने कहा कि इस केंद्र द्वारा एक ही छत के नीचे आईयूआई, आईवीएफ, ICSI, हिस्टोस्कोपी, पीजीएस और पीजीडी सहित लेप्रोस्कोपी सर्जरी और अत्याधुनिक ART उपचार से लेकर सभी प्रकार की सेवाएं उपलब्ध कराई गई हैं। अपोलो हेल्थ एंड लाइफस्टाइल लिमिटेड के CEO चंद्रशेखर सिंह ने कहा कि लाजपत नगर में सबसे बड़े अत्याधुनिक फर्टिलिटी सेंटर को लॉन्च करते हुए बेहद खुशी है। उन्होंने कहा कि इस बाबत अधिक जानकारी के लिए आप हमें 186050044424 पर संपर्क कर सकते हैं। देखिए यह रिपोर्ट।
See, whenever we do any IVF, there is one thing is called basic assessment. So it's not just that someone has referred you. Just you do as a clinician, you do a basic workup. So we do the testing for the females, we do the testing for the male, and then we make sure that everything is okay to go ahead with IVF in that particular patient. So that safety check and that basic assessment, of course, we follow. Now the question is, I think what you're trying to ask is whether these injections can cause tumor. No. It's a relatively safe. If somebody has a anyway history of family history of malignancy, or somebody has had, so that can be there. But because of someone just mentioned 9 million babies have been already born, so it's a long it's a big number, and that too worldwide. So you may say that in India the documentation is a little weaker, but in some of the countries every IVF case is documented and every outcome is documented in Western part, and which is going to start here in India as well with the help of this new ART Act. So in a new ART Act, every case will be registered, every outcome, every complication. So I think it's then we will develop the Indian data as well. And not only the government, a lot of the big centers, fertility doctors now, they're working, and even the IFS, they're working on creating and working on Indian data. Because see, Indians are a little different than Western. We all used to read and now also read Western. So now in a year or two we'll have Indian data, and I think that will help the government to prepare more realistic policies and more the policies which are very much applicable for the Indian population. So yes, it's safe if done at a right center in a right way.
Just to add there, sir. Because humans are, we have genes, and genes are different. Like she said, we study or doctors refer to Western data. We are working on Indian. And Indian gene pool, the Asiatic gene pool is different. So now there are advanced treatments like PGS, pre-genetic testing, screening, diagnostic, which the doctors also use. So in certain cases, like you said, there is a genetic or hereditary disorder which is there. Now the doctors also have the capability of weaning out those abnormalities before they go ahead with the IVF treatment, right?
So they can that's a pre-implantation transplantation genetic diagnosis. That means if anyone has a family history of genetic disorders, we can do a workup first, and in that case when we create embryo, we can see in each embryo which carries the abnormal genes, and we can discard. So this is so much good for the couple, because later they don't have to go termination, or later they don't have to have a child with abnormality. So this is another advancement of the IVF, where you can do a selection of normal chromosomal or genetic, which the family has been suffering for years.
That you do at the lab stage?
Yes, lab. When you take out the embryo, when you make, you take out the egg and sperm, you make embryo, then we reach up to day 3 or day 5, and then you do that genetic testing with all the counseling and all the, in the proper way, and then which embryo has the disease, which embryo doesn't have. And the one which is a disease free, we put it back.
Ma'am, I think a number of IVF centers in India out there. So how the people can understand that this is the right place and that
So I think that is where the ART Act has come. So one has to see whether the they are registered with their registered center. And the registration is, and this is the first time in India that these national boards or the state level boards, they're actually going to visit, they're going to inspect. Earlier we used to have only ICMR where the guidelines were there, they never actually visited. So now with this act, they will visit and then they will say, yes, this is registered. Then a doctor, then a couple knows that this is a registered center by the government, and one can visit there. There will be regular monitoring by the team, which is the boards formed by the government, and so there is a check. There is a check by the government, and of course there can be different levels of centers. Like the bigger centers will probably keep all the latest advances that a patient can visit and can check the websites, and then they can come forward for the treatment.
What facility will be provided in this center?
So this is a complete center. This is a sort of, we have the basic, right from the basic evaluation, fertility evaluation, or like for fertility preservation, somebody just wants to freeze egg or sperms. From there onwards to, the advanced technology, we also have the micro teaser where the male factor infertility is there and they want to take out those occasional sperm. We do have those facilities. We do have the technology like, the other time lapse and other advances. PGT also we have. So it's a complete one-stop solution for anyone who, it's going to be one of the best centers. It already has all the facilities.
I would like to answer that question. जैसे मैंने बताया था कि फीडबैक, और फीडबैक के लिए ना आपको खुद मेहनत करनी होगी, आपको अलग अपने रिव्यू पढ़ने होंगे, और अब हम इस मोड पे नहीं है कि ये टेक्नोलॉजी सेफ़ है या नहीं है, हम उससे बहुत आगे आ चुके हैं. अब क्वेश्चन है कि इसको कैसे ज़्यादा से ज़्यादा एक्सेसिबल कराया जाए, इसको ज़्यादा सेफ बनाया जाए, ईजी बनाया जाए, जिसे हर एक व्यक्ति, एवरी इंडिविजुअल शुड हैव कंप्लीट नॉलेज हाउ टू गो अबाउट इट. लाइक प्रोसीजर क्या है उसका, स्टेप 1, स्टेप 2, स्टेप 3, स्टेप 4. और जैसे अभी डॉक्टर श्वेता मैम ने बताया, जैसे असिस्टिव रिप्रोडक्टिव टेक्नोलॉजी एक्ट, दिस एक्ट इट इज़ नथिंग बट अ गवर्नमेंट टेकिंग अ कॉग्निजेबल स्टेप that we know what it is, and they have set up a procedure, they have set up different mechanism to have a check and balance. आपको अपनी स्टडी खुद से करनी पड़ेगी इसमें, क्योंकि अपोलो being a good brand and other brands also, I'm not saying that one brand is good than the other brand. You do your own research, or that would be a question, and in fact जितना ज़्यादा आपके पास में choices होंगी उतना ही अच्छा है.
Great point, sir. So unfortunately, so far, IVF treatment has been clubbed under what you call elective or discretionary procedures, and like dental procedures or cosmetic. So it's not covered by insurance. But like I said in my note, that even the World Health Organization (WHO) also says it's a disease. It's a medical condition which has to be medically managed. It's not an optional treatment. People who go through IVF or require IVF are the ones who are in the need of it. So, but at the same time, there are some I'll say insurance companies and companies at a corporate level also who are trying to make this more accessible. So there are some products that we are creating to ensure that this gets covered. We have also been in touch with insurance companies. We work with corporates also, where because a lot of employees in corporates want access to IVF. So we are working with the providers as well as corporate partners to ensure their employees and staff can access.
मैम आपसे क्वेश्चन बनता है, अगर कोई पेशेंट हो जैसे IVF यहाँ से करवाया हो और वो ट्रीटमेंट कहीं और से करवाना चाहे 9 महीने, तो या यही है कि
नहीं वो करा सकता है। हमारा फर्टिलिटी का एक बार जब प्रेगनेंसी पॉजिटिव हो जाती है तो वो पेशेंट अपने घर के पास वहाँ पर करा सकता
कितने
है।
महीने बाद?
हम इमीडिएटली हम थोड़ा सा शेयर्ड केयर करते हैं शुरू के 2-3 महीने, जब हमारा कोई हार्मोनल ट्रीटमेंट चल रहा है उसके बाद हम वहाँ के जो लोकल है घर के पास जो आपका ऑब्स्टेटिक सेंटर है आप वहाँ करा सकते हैं।
इस सेंटर पे वी डोंट डू डिलीवरी, यहाँ डिलीवरी नहीं होती, यहाँ केवल IVF और IVF ट्रीटमेंट।
देश दुनिया की हर लेटेस्ट खबर देखने के लिए सब्सक्राइब करें हमारे चैनल PNN को और साथ ही बेल आइकन दबाना ना भूलें।